Mr. Smith. My name is Brittany. I'm going to be doing a full head-to-toe assessment on you today. Okay?
Okay.
Okay, let me wash my hands and we'll get started.
All right.
Let me just close this curtain to give us some privacy. Okay, so do you know how tall you are?
6 foot.
6 foot. Okay, do you mind stepping on the scale and I'll get your weight? Okay, 242. Good deal. Okay, I'm going to get a couple of vital signs from you. I'm going to get your heart rate, your blood pressure, your respiratory rate, and your temperature. Okay? So we'll start with our blood pressure. You can just relax for me. We'll put this around your arm. Just relax your arm for me. Just relax it on my elbow. Okay, your blood pressure is 110/70. Okay, I'm going to check your pulse. Okay, your pulse is about 72. I'm going to listen to your respiratory rate. Okay, you're breathing about 18 beats per minute. Now I'm going to check your temperature. I'm going to stick this underneath your tongue. If you can just close your mouth for me. Okay, 98.5 is your temperature. Okay, so now I'm just going to start with my head to toe. I'm going to start with your head and work my way down, okay?
All right.
I will be using a few instruments today, but I will let you know what they are and kind of go tell you what they are about as we go along the assessment. Sound good?
Sounds good.
Okay, let's get started. So right now I'm just looking at your skin and checking your color. Your color looks nice and pink. Your cat refill is good. I see you have some moles, but I don't see that there any abnormality to them. Okay. I'm going to turn out my light and I'm going to take a look at your eyes, okay?
Okay.
Okay, Mr. Smith. This is a bright light, but just see if you can look forward for me. I'm going to take a look in your eyes.
All right.
And I'm just checking for any edema back behind your eyes. Anything abnormal back there? Good. I'm just seeing how your eyes react to my light.
All right.
It looks good. Okay. Turn my light back on. Now I'm going to take a look at your ears.
All right.
I'm going to use a similar scope, just a little different, and just take a closer look inside those ears of yours. Looks good. Good. Okay. Now I'm going to take a look at your nose. I'm going to use that same scope and take a look inside, okay? Now I'm going to press against your forehead, just above your sinus cavity, right in here. Just let me know if you feel any tenderness.
Okay.
No tenderness there?
Not yet.
Okay. What about there? Any tenderness?
No.
Okay. I'm just kind of seeing if there's any lumps or bumps in your neck and around the area. Everything feels to be normal. Okay. I'm going to take a look inside your mouth. This is just a tongue blade. I'm just going to take a peek. Can you say ah for me? Good. Now I'm going to take this blade and I'm just going to stimulate your gag reflex just a little bit, just to test a cranial nerve back there, okay?
All right.
Good. Can you clench your jaw for me? Good. Okay. I'm going to take off my gloves. I'm going to use another instrument. This is a tuning fork, and this will make a little buzzing sound when I hit it. I'm going to place it on top of your head, and it's going to test to see where your hearing is best. So tell me if you hear the buzzing louder on the right, the left, or the middle, okay?
The middle.
Middle. I'm going to use the same buzzing sound, and I'm going to test your ears in a different location. Tell me if you hear it on the A or B.
A is stronger.
A is stronger. I'm going to try the other side now. A or B.
B.
B. Good. Now I'm going to test several different cranial nerves. There's different cranial nerves up in this area. I'm going to use an eye chart. I want you to stay sitting there, and I'm going to take some few steps back, and I want you to read the bottom line read as low as you can go.
All right. O-R-Z-S-K.
Okay, cover up one eye, and I want you to read the smallest line you can.
O-R-Z-S-K.
Okay, switch eyes, and do it one more time for me. The smallest line that you can read.
O-R-Z-S-K.
Good. Okay, now I'm going to have you face forward without moving your head. I want you to follow my finger just with your eyes, okay?
Okay.
Good. going to take a Q-tip and I'm going to test your sensation on your forehead.
Okay.
If you can let me know if it is dull or sharp.
All right. Sharp.
Good. Dull or sharp.
Dull.
Good. Okay, now I'm going to whisper in your ear from behind you, and I want you to stay facing forward, and I'm going to have you repeat that number to me out loud, okay?
Okay. 99. 21.
Good. Okay, I just want you to look forward at me, and I want you to raise your eyebrows. Good. Relax them. Puff out your cheeks. Good. Relax. Show me your teeth. Good. Relax. Now stick out your tongue for me. Good. Okay. Now I've already looked at your neck, but I want to take a look at your thyroid gland. It's just right in here. I do have a cup of water right here for you. Can you drink that for me while I observe your thyroid gland?
Sure.
Put your head up a little bit. Good. Okay. Good. Now I'm going to observe it from back here, but I'm going to just kind of feel around while you drink your water, okay?
All right.
Good. Thank you. I'll take that from you. Okay, Mr. Smith, can you shrug your shoulders up for me? Good. Now bring it back down. Good. Okay, I'm going to do a little bit of range of motion right now.
All right.
Checking your joints, checking your biceps and your shoulders.
Okay.
First, can you grasp my fingers for me as tight as you can? Good. Release. And one more time. Good. Okay. Take your hands. And your shoulder. Good. Now one more side. Your bicep. Good. Everything's moving nicely. And your shoulder. Good. Okay. I'm going to take my hand and I'm just going to press it against your neck, your jawline, and I want you to move your head towards my hand. Good. Other side. Good. Okay. So now I'm going to go to your back side. I'm going to listen to your lungs. I'm going to palpate, and I'm going to also do a little percussion on your lungs. Okay?
All right.
If you can turn to the side for me, that might be the best way. I'm going to put my thumbs right here for me. If you can take a deep breath in and then exhale deeply as well. Good. Now I'm just going to percuss. I'm going to untie this top of this gown right here just so I can get to the upper part of your back.
Okay.
Now I'm just going to listen to your lungs. Just breathe normal for me.
Okay.
Your lungs sound good, nice and clear. I don't hear any different sounds. If I could, I'm going to get you to lie back in the bed, and I'm going to assess your chest wall, your heart, and your lungs.
Okay.
Okay? If you could, I'm so sorry, Mr. Smith, that I have to do this to you, but if you could take off your gown so I can get to your chest a little bit better, and I will cover you up. Thank you. So right now I'm just going to feel around your chest wall and your breast area. You still, even being a male, you still need to self-examine that area every month or so, and so that you can make sure there's no extra bumps or lumps in those areas, okay?
Okay.
Good. I don't feel anything abnormal in that area. Now I'm going to just feel around your chest wall. Okay. And I'm going to do some percussion, same as I did on your back, but on your front side, okay?
All right.
Okay. Now I'm going to listen to your lungs on your front side. Just breathe normally for me.
Okay.
Okay, good. Your lungs sound clear on that side as well. Now I'm going to check your jugular vein right here. I don't see any distension, but I am going to do a little bit of a measurement. Okay, can you turn your neck up for me? Thank you. It seems to be about 6. So that pressure looks good, looks to be normal. Now I'm going to listen to that area, and then I will listen to your heart as well.
Okay.
Okay, you have a normal heartbeat, just an S1, S2, which is good. It's what we're looking for. We're looking for that normal heart rhythm.
Yeah.
Okay, and now I'm going to move to your stomach. I'm going to listen to your bowel sounds. I'm also going to just kind of palpate and inspect your abdomen, and then I'll do a little bit of that percussion that I did with your lungs.
Okay.
Okay? Do you feel any tenderness when I press?
No.
Anywhere in here?
No.
Okay. gonna listen to your back sounds now.
All right.
You sound good. Looks like you have some scarring on your abdomen. Did you have your gallbladder removed?
I did.
Okay, I noticed that. Okay, so we're gonna go ahead. I'm gonna look at your legs while you're still lying down and just check for some edema. I'll also will check your range of motion in your legs and some pulses. Okay. You can cover your chest back up if you like with your gown. Got it?
Yep.
Okay. So I'm just gonna move this blanket back. If you can just relax your legs for me. Are you able to scoot up a little bit more in the bed? Good. Thank you. Okay. Your feet pulses are good. They're normal. They're called pedal pulses, and they feel nice and strong. So does your knees. I don't see any swelling in your knees, nor do I see any swelling in your ankles. So that looks good. Can I bend your knee up for me? Okay. Good. And do your other leg. Good. Okay. Now I'm just going to use my little hammer here, and I'm just gonna tap your knee. I want you to relax your leg. I'm gonna tap your knee. I'm checking your reflexes, okay?
Okay.
Good. Relax your leg. Good. Good. Okay. Everything looks good on your lower extremities. I'm gonna have you sit up.
All right.
Now I'm gonna check your spine and just some movement in your hips.
Okay.
So if you would like to stand up for me, I'm gonna come around to the side. Here, I'll come on this side. Stand this way for me. Now if you can bend down, Mr. Smith, and try to touch your toes for me. Good. Okay, go up, stand back up. Now I want you to do a twist for me. Okay, other side. Good. Okay, do you see your curtain right there? I'm gonna get you to walk there and then turn around and walk back for me.
All right.
Good, your walk looks good, nice and steady,
Okay.
nice and good. If you can have this seat right back down for me. Okay, so that ends our assessment today. I found that everything seems to be normal and looking good. We did see that scarring on your abdomen from a past surgery, but I didn't see anything abnormal in my assessment today. I do want to follow up at the end, and I just want to encourage you to get an annual prostate examination by your doctor.
Okay.
That is important, especially being 34 years old, and you want to start getting that kind of looked at. So I would recommend that you follow up with that, and also if you could do those examinations when you're in the shower around your breast area.
Okay.
Okay?
Sounds good.
It was nice meeting you, and
Nice to
thank you
meet
for
you.
letting me do this assessment.
Absolutely.